Before watching this video, don't forget to subscribe to our channel by clicking the subscribe button below and click in the bell icon.
If you are faced with a tough decision in healthcare, then you, of course, will want to listen to what your healthcare provider has to say and seek their counsel. Many times your healthcare provider is the only resource you may feel you need. But sometimes you need to get more information when you have to make significant decisions about treatment. Accessing second opinions, taking time to research things for yourself and evaluating all the information available may seem daunting if you are facing chronic or acute illness. But it is in your best interest to take a quick survey of all you can when you are facing life-changing treatments or substantially altering surgery, chemotherapy or medications with high-risk side effects. Step number 1: take a deep breath and just try to let your mind relax when you are faced with tough decisions. Remember this, you are your own best analyst when it comes to your health, and only you really know your values and the risks you are willing to take. Step number 2: listen carefully to your healthcare provider. Ask questions when you are done listening to get all the information you can. Take your best friend, a nurse friend, your mom, sister, dad or brother with you to the office visit. Step number 3: have the person who came with you take notes on the visit. Also have them document the answers that your healthcare provider gives you when you ask questions so you can review the notes together later. Step number 4: get a time frame for your decision. Once you have finished your visit, if there is a treatment decision, then ask your healthcare provider for evaluation time. Hopefully, you have some time to make decisions about treatment and will have an opportunity to review your notes before you engage in appointment making and plans for treatment. Do not let office staff or scheduling issues pressure you to make a commitment before you have had time to evaluate your decision fully. Step number 5: review your notes. Once you are back home, go over your notes with whomever accompanied you to the visit. See if there are any gaps in information, or further questions you have formed as a result of the review. Step number 6: take a bit of time to research your diagnosis on the internet. Use well-respected sites. Some good resources are WebMD, Mayo Clinic, and the National Institute for Health websites. There are many other excellent sites, but these are 3 trusted and general health-related resources. Step number 7: try to avoid chat rooms or unreliable sources of information on the internet. You want top-of-the-line research-based material to make the best possible decision. You do not want to be reading about worst-case scenarios or fear-inducing drama when you are facing tough choices. Step number 8: check out some of the sites which deal specifically with your particular problems. For instance, if you have heart issues, you might want to visit the American Heart Association website. If you are fighting a cancer, there are many cancer-specific sites with good supportive networks available. Step number 9: ask a pharmacist about any medication options or considerations. They can be a great resource. Ask about the side effects of any drugs you are asked to begin taking. Every drug has a pharmaceutical profile and all drugs have some risks involved. Ask your pharmacist to rate the risks and review any precautions, taking into consideration any of your health history which might be important. Step number 10: seek counsel from your family. The family members of your household may have excellent observations regarding your illness and how it is affecting you. However, remember, you are your own best resource when it comes to decision making. You are the one whose health is on the line. You should not ever make a decision which will affect your health because someone else wants you to make that decision. You should always consider your options and choose according to your own values and comfort.